Hi, this is Sandy. Welcome back. Our quick fix today is designed to offer some relief to sore feet. It will also help to prevent future bouts of discomfort. I so often hear, "My feet are killing me." Almost as often, those who say that plantar fasciitis is the cause of their pain. This has become a catch all term for sore feet, but more often than not, it is, if not misused, misguided. Plantar fasciitis does refer to an inflammation of the sole's fascia, that is, a layer of tissue between skin and muscle, or wrapping around a specific muscle. So, yes, your plantar fascia may be inflamed, but that is likely not where the story begins or ends. From personal experience and to having helped others with mysterious foot pain, I've found that mobility and alignment issues in the foot and ankle, even the knees or hips, turn out to be the true culprit. So, both some babying and working of the feet are key to relieving and preventing sore feet. So, let's begin seated. Find a position that allows you to hold the right foot with both hands. Once you're set, grasp the front half of the foot, one hand on either side, thumbs on top, fingers on the bottom, and begin to twist the foot by pressing the left side down as you pull up on the right side, then up with the left as you push down on the right. It is as if you are wringing out the foot. Do this at a fairly steady pace, not too slow or not too fast, just the Goldilocks of wringing pace. Do this for about 30 seconds and then pause. And now use the thumbs to stroke through each groove between the long foot bones on top of the foot. Work from the midfoot toward the toes. Again, do this firmly at a steady pace, as many times as you like, working through each groove. And then you can release the foot and move over to the left foot. So again, first hold the front half of the foot with both hands and wring it out for about 30 seconds. You may find that your foot barely moves at first, but it will unlock and begin to twist more freely. Any limitation in the foot's mobility can easily turn to pain. Okay, when that feels done to you, move to the thumb strokes between the metatarsal bones, working through each channel from midfoot out to toe. Go back and forth. Again, do this for as long as feels right to you. And then from here, come onto your hands and knees. Lift the left foot and lower leg a few inches, keep the knee on the ground, and begin to swing the left lower leg from side to side. Keep the hips stable, knee grounded as you do this familiar windshield wiper movement with the lower leg. Think of leading the swing with the heel. This will prevent your foot from sickling. When the left leg swings to the right, it crosses over the right foot that's on the ground. Go back and forth a few times, and then begin to turn your head to look back at the foot. Look left as the foot swings out to the left, right as the foot swings to the right. Let your spine curve from side to side as you turn the head from side to side. And then, after about 30 seconds, pause, and then begin the lower leg swing on the right side. So, for the first few swings, keep the head and torso still. And then once you find your rhythm, add the looking to each side as the leg swings from left to right. Again, let the back bend laterally from side to side as the leg swings and your head turns to look back at the swinging foot. This is a lesser known way to ensure alignment through the hip, knee, ankle chain. Okay, let it all go, and if they're not all ready, curl your toes under and sit back onto your heels so your spine is fully upright. This toe flip with your weight perched on top of the feet gives an excellent stretch for the soles of the feet and the toes. So this position can be a bit uncomfortable at first, so try breathing in through your nose and out through open, rounded lips. Slow, steady breath in through the nose, long, deep breath out through the mouth. Stay with this for at least 30 to 60 seconds. Again, your feet may not appreciate this at first, but they will ease into it. It's simply an unfamiliar stretch for the soles of the feet. Okay, and now gently release this by shifting forward back onto your hands and knees. And from here, simply help yourself down onto your back, however you get there. Knees are bent, feet flat, hip width apart. Arms are just resting on the floor by your sides. Take a big breath in through the nose, then exhale as you drop both knees to one side. Inhale back up to center. Exhale, drop the knees to the other side. Go back and forth, side to side. Always inhaling center, exhaling, drop to either side. So now we're rolling through the hip joint as well as through the feet. The knees are finding their proper home in between. This idea of establishing alignment through the ankle, knee, and hip joints as a way to offset and prevent foot pain harks back to something I learned in massage school, which is that when an area of the body is in distress, look to the joint or muscle group above or below. Here we're covering our bases by working with the chain of three main joints above the feet. Okay, you can pause your knee drops. From here, extend both legs straight up into the air. Be sure your knees are directly above the hip joints. You want your belly to be fully relaxed. And now, as you inhale, bend both knees and flex the feet at the ankle joints. This is pulling the toes down towards you. Exhale to press the legs straight again as you point through the feet, lengthen through the feet. Inhale to bend and flex. Exhale to straighten and point. Do this inverted bend and straightening move to help with mild inflammation in the feet. And after about 10 to 12 of these, bend the knees down into the body for just a quick roll around on your back. And then lengthen first one leg, then the other long onto the floor. Let your eyes close. And as your breath settles and steadies, you can add a simple visualization to release pain. Inhale slowly and deeply through the nose, mentally isolating any sensation of soreness in your feet. As you exhale, send that pain right out through the soles of the feet. Inhale to grab hold of pain in your feet. Exhale to eject it through the soles. Keep breathing in this way for as long as you like. Thank you for practicing with me. Until next time, bye.